and it's never been that high. Even in past years when we didn't have these good drugs, it was never this high.
Even when the awareness was not there.
Yes, it was
I
never this high. It was
been,
usually, I don't think we've had any record of up to 20%. You know, currently the national prevalence is 1.4%. Yes, River State is higher than the national prevalence. We're one of those states with high prevalence. Well, we are third based on the last survey that was conducted. Akwa Ibom is first at 5.5 or thereabout. Benue is second at 5.3. Then we come third at 3.6. So we are not anywhere near, and we can never get there. We don't hope to get there. So thank you so much for taking our time to read out.
Thanks for joining me this morning to enlighten the people on this very topic. Okay, we know that initially we were not aware, but now I know that most people are aware, and so most people are taking precautionary measures to make sure that their status remain positive, negative and not positive. Okay, so HIV/AIDS, has been here for a long while now, and what exactly is the ministry doing to make sure that the news going round actually? Because I don't know what people really have in mind. Sometimes we prefer reeling out the negative information out there instead of positive, and we like remaining negative instead of being positive. So how do we really go ahead to more people? I know this is one of the ways we're doing this now, informing the people, going on air and informing the people about what is on ground. So what measures are we taking to make sure that the rate we are at the moment comes lower, because it could only get better. Of course, it could only get better. So let's not think of remaining in third place. Yes. So what do we do to say that we move away from third place? Now, it's better to start off from the known to the...
All right, so thank you very much once again for that question. First and foremost, we all need to know our status. And how do we know our status? We need to get tested. You need to walk into a health facility. I can bet you all the government facilities, HIV testing is free. There are some private hospitals that are supported to provide free services. So you can walk into any government hospital and say you want to know your status. You will be counseled, and then you will be provided information, and then your consent will be obtained for them to proceed with the test. And once you know your status, whether positive or negative, we have services for you. So the services is not just for the positive. We also have to offer some form of services, what we call preventive services, even to those that are negative. So if you are negative, we have to provide information. There are some other services we need to provide to help you remain negative. If you are one of those that is negative, but you have a high risk behavior, then we may have to counsel you on taking medications to stay negative because of your high risk behaviors, like those female sex workers, people who inject drugs. We see them as high risk that can transmit this infection. Since we're not able to change their social behavior, then we want to ensure they remain negative. So we also offer them services, which is what we call preventive services, such as giving them medications called PrEP, pre-exposure prophylaxis, to keep them negative so that they don't get the virus. And it's also used for what we call discordant couples, where you have one partner that is positive and the other is negative. You could also make the negative partner, while the positive partner is taking some set of drugs to reduce the viral load and stay healthy, the negative partner can also take some set of drugs to ensure that the chances of transmission from is reduced to the barest minimum. So our services are not just limited to positive, we also offer services to negative. Now, still on measures to ensure that we curtail the transmission. Of course, like I said, first you need to know your status. So we commenced this year's World AIDS Day actually commenced for us as a state on Monday. Our press officer ensured that there were jingles in most radio and TV stations in the state to provide more information, to let people know what they need to do, to let people know that they need to get tested. So throughout this week, most of the major stations in the state we have jingles that are being aired. The commissioner's broadcast telling people what to do and how to stay negative is also being aired. We had a rally, we had a mega rally on Monday at Model Primary. The anchor point was Model Primary Health Center, that's near the Obiapo Secretariat. And that's a very busy axis. So we walked all the way down to Federal Government College, Port Harcourt. We made a U-turn and walked all the way down to Ruboku. What were we doing? We're providing information. we were distributing flyers, we were
Okay.
enlightening the public. And I think for me, that was a very good one because you know how busy that junction is. There's a
Exactly.
major market, there are motor parks around there. So we're able to provide information. And beyond this, we had what we call testing points, both at the health center, at Umokoro Junction and at Upoku Junction. So we provided testing services to the public because we are providing this information, but we also wanted people to get tested. So we did this on Monday, and we're continuing. Beyond Port Harcourt Metropolis, from today, we are doing in 4 other local governments. As I speak to you, 9 o'clock, they should have commenced. I think if I get this schedule correctly, today is for Okomoko, that's Eche local government. I'll be joining them once I leave the studio at Eche. They are having the same rally starting from the General Hospital Okomoko, and they're going to walk and try and raise awareness along the streets and all the way to the Agri markets, and then they will circle around that area. Same thing is going to happen in Kana local government area today also. They will also be conducting a rally from the zonal hospital to the Boye market to raise awareness. Tomorrow we will still have 2 local government areas. Tomorrow it will be Oyigbo local government area from the Comprehensive Health Center Oyigbo. They are also going to walk down. And then finally we have Aoda East also tomorrow. They will be doing that from the Modern Primary Health Center Aoda towards the local government secretariat.
That's a whole lot. You really
Yes,
have a whole lot
we wanted
in
to
your
cover
hands.
the senatorial district. So we
Okay.
wanted to ensure that at least 1 local government per senatorial district received this awareness. But it's not going to end with the World AIDS Day commemoration. The World AIDS Day just helps us to amplify our voices.
So it's going to be a
Yes, it's going to be a continuum from engaging the public vis-a-vis radio, TV stations like yours.
I think that is really very important. We shouldn't just rely on kicking off something, especially when we have a day set aside for it. Then blow all the trumpets, and after then we just relax and forget about it.
It's going to be
there are a whole lot of people who might not even be opportune to hear about it now. But when it's done over time, when I'm aware, I can tell someone close to me who can just carry on, and all that. And so there is this particular notion that, we're always saying HIV is, most people think it's a death sentence, but now we know that it is not. But up to this moment, nothing has been done to really find a cure to HIV. And there are people who are claiming that they have cure for HIV. I don't know how true is it, so that we don't pass on the wrong information. There are those who feel that when I catch it, I will just go to a particular place, take some shots, and I'm okay, and that's it. And some people just carry on with those careless attitudes and lives and all that, and hope on going to those points who claim they have a cure for HIV. So what do you have to tell us about this? Cure or no cure?
I like your intentionality with your words. Claim. So it's a claim. And we are scientists, so there must be evidence. Whatever we are doing is based on evidence. Like we had my Honorable Commissioner say, evidence before us says we are 3.6%. So until that evidence is set aside with another study, another survey. So currently there's no cure for HIV. What the world has been able to achieve, it's controlling it, is what we call virus suppression, is providing drugs that are able to reduce the replication of the drug, of the virus. So once the replication is once the virus cannot replicate,
it's controlled.
There's a control, and that's why once there's a reduction in the number of virus, the chances of transmission is minimal. And once it can no longer be transmitted, then it can be curtailed. So the aim is a control. It's an epidemic control vis-a-vis suppressing the virus in those that are already positive, ensuring they have the right drugs to take. And the good thing now is the drugs available right now, it's like wonder drug. It was introduced at about 2018, there were about the new drugs, quick response. And if you watch, you don't see those people looking like those.
We don't see cases of AIDS. Malnourished.
Yes, it's because of these drugs. About 5 months ago, I had a patient coming, elite patient, not looking too good and all that. And we commenced these drugs. Within 1 month, there was a drastic reversal. She had gained weight. Even right now, she's even complaining of too much weight gain, like she's doing so well. because she's taking the medication and she looks healthy. Like they say, HIV no the show for face.
No, the issue again, my sister. I tell you.
So, and for those taking the drugs, minimal side effect. I think in the past, what we had was one of the drugs that was being used for HIV used to have this, will I say, it used to affect their mental state and all that, and their sleep. And once you have those disturbances, they don't want to take the medication because of the side effect. And of course, then the virus continues to replicate. They continue to get sick. They continue to transmit it. But with the drugs that are available, and we have them in country, in the state, and people are taking it, our virus suppression rate for those taking the drugs is over 97%.
Yeah, I think that is the more reason why people should be more careful with those who relate to it sexually. I tell you, because now HIV not the show for face. It was not like past in the days when you see someone looking so sickly and you're very careful. But now it doesn't show because they are on their drugs, which is a good thing. But that also should increase our level of being careful with relating to how we use the sharp objects, how we use things that really can expose
blood
exactly transfusions and all that. So exactly.
Ensure that the blood to be transfused and properly screened to avoid the chances of that. And then one very major aspect of this HIV control is pregnant women. The data for pregnant women is not too good. We're still finding children born. For us as a country, we're still talking of prevention of mother-to-child transmission. Other countries are already talking of elimination, as in complete elimination. For the pregnant women, we're now intentional about what we're doing for them. We notice that they don't come to the facilities, they go to those traditional birth attendants. So we're not taking the services to them because it's very important for the control of HIV. We must halt the transmission from a pregnant woman to an unborn child. So I want to implore every woman of reproductive age, those intending to get pregnant and those that are pregnant, it's very, very important. For the sake of your unborn child, for the sake of our future, you must know your status. These drugs are safe in pregnancy. We have women that have taken it and they've actually given birth to children that are negative. Wow. So many of them with those testimonies, because what we are finding, the children that are born negative, children that come out positive, with HIV, we've noticed that these women don't access services. Yes, they don't access. So we are pleading. We've taken the services. We have teams in the communities going house to house to look for the pregnant women, going to the market to look for pregnant women, to ensure the testing services are offered to them. And when they are tested, they know their status. For those that are positive, they are now referred to the appropriate centers for care. It is very, very important. And this service that we're providing, like you read, I'm not just in charge of HIV, I'm also in charge of viral hepatitis and other STIs. So for the pregnant women, we're ensuring that they get tested for HIV. Syphilis, we have a dual combo testing, just one kit, one drop of blood, and you can check the woman's status for HIV and syphilis. We also have testing for hepatitis. We want to ensure that these three diseases don't get transmitted to our unborn child. So that's what we are referring to as triple elimination. So for us, it's very, very important that the pregnant women it's a must for pregnant women.
There are those also who might be in areas where assessing health facilities could be very difficult. There are some rural areas, they have let's say the usually called general hospitals, but most of them now are not minimally functioning. Some of them are not even functioning.
Sorry, that's not true.
Some are not. At least I know somewhere in some of our local government.
You said most, not some.
Okay,
some are not.
Okay, yes.
Some
in
are
the
not,
rural areas.
Yes, some are not functioning. But there's no local government area that doesn't have at least 2 to 3 functional, well-equipped primary healthcare centers. Mind you, the primary healthcare centers
maybe I shouldn't use local government area generally. Okay. I should use maybe some communities. Okay. In certain local government areas, not all the local government areas.
We have over, I don't have the exact figure, but I can tell you we have over 200, if not up to, over 200 primary health centers that are functional. Quite a significant number of those primary health care centers under the Basic Healthcare Provision Fund have been renovated, they've been revitalized, they've been provided. I think there was, was it 2-3 weeks ago, the Honorable Minister of Health, he released a red alert. I wish I had known I would have brought that out. It was a red alert to the Nigerian public saying, go to these health centers and hold them accountable. Funds are being given to them to ensure that they are functional. That is an effort, and Rivers State is key into that. We actually even won an award based on our primary healthcare system. I can't remember what position, but we're among the top 3 performing states for primary healthcare. And over 200 of these primary healthcare centers are functional, operational, being supported under the Basic Health Provision Fund to provide these services. The primary healthcare center, just like the primary school, are the first point of contact. At least
so there shouldn't be any reason
why people cannot access healthcare in any area of our state currently. And beyond that, of course, our governor is also rehabilitating the secondary health centers. Zonal Hospital Bori was recently commissioned earlier this year, and others are soon to be commissioned. I know our order has gone a significant, they've gone far. The neuropsychiatric hospital, even in Port Harcourt, with the Port Harcourt General Hospital, will also soon.
What about Alimini? Somewhere before Ahoda?
I know the General Hospital you're talking about there. It's currently not functional, but I'm sure sooner or later something.
Because most people from that village had to go to Ahoda, so go to Emohua and all that.
They don't necessarily have to go to Ahoda. Well, I'm trying to see which is closer to them, because we have Umuji, we have Udele. Those are health centers that are fully operational. So that may be closer to them than going all the way to Ahoda. But if they are comfortable with Ahoda, why not? Why not?
Because I think Ahoda is like a stone throw to than Rumuji and Emohua. It's like going backwards, and And what I wanted actually to talk about is having to reach out to these traditional birth attendants, so that at least they will have sometimes most of these things that help encourage the boosting of this virus, transmitting and all that.
We're actually working
the equipment they use.
So we're actually working with them. We have a list of some that we have trained, and we will keep expanding that list. So we're actually working with them. They are not recognized per se, but we know our women know them.
Yes.
So we're not using the fact that what they are doing is not medical.
We're aware that they are being used.
So, but because they are being used, so like I said, we're intentional for the pregnant women. So we've trained quite a significant number of them over the past 2 years. And we've again, coincidentally, sometime last month, we actually had a meeting in the State Secretariat, the Ministry of Health, with over 75 of them. They were invited. We had discussions with them, because these are traditional birth attendants that have been trained on providing at least the testing services, or knowing where to refer the woman to get tested. If you are able to provide, maybe you are a retired nurse and you are able to provide these services, then you are trained to provide that services. For those that are not healthcare workers, we provide them with the support services to know where to refer these women to get tested, because it's very, very, very important. So we're not leaving that aspect of the healthcare neglected. I mean, the traditional birth attendant. We're seeing how we can improve their knowledge, make them know that they need to. And we tell them it's not just about the pregnant women; it's also for their own safety. Because in the course of handling these women, they could also in the delivery process, we provide them with gloves, we give them little incentives that makes them want to collaborate with the state. We provide them with gloves, antiseptic that helps clean their places. We actually visit them to see what they are doing. From time to time, we send our healthcare workers to visit them, especially those in the local government, because the 23 local government, we have what we call the 5-man team that are responsible for supervising them and checking what they are doing to be sure that they are providing the right services and they have the right information.
That is very important. That is very important. One very important thing we should take home today is whatever is going on social media cannot all be true. Especially this particular graphic that is going on now, that Rivers State, is about 86. Which means everyone of us.
Everyone.
So the right information is that the level of HIV, those infected, is about 3.6%. 3.6%. Against the 86% that is going around at the moment. So we can take that home. Yes, we can. Okay. Thank you very much, Dr. Ufoma, for joining us this morning. I think we want to have your last words. about HIV.
All right, thank you so much once again for having me, and thank you to the public for listening in. Please, please, please do not discriminate, do not stigmatize people living with HIV/AIDS. They are people like you and I. They need our care, they need our support, they need the right information on where to go to get this support. So please, kindly, the good people of River State, do not discriminate, do not stigmatize people living with HIV/AIDS. What they need from you is your love, your care, and your support. And taking the right drugs, they will get better by the day.
Yes, with proper management, the virus can be reduced to, the barest minimum. Thank you very much for doing this with me this morning.
Know your status. It's very, very important. Know your status, so that you will know what to do.
Yeah, I think one thing we missed is, are there any number people can call in case you have an issue, and you can just walk into any health facility?
They can walk into any health facility.
Okay, so it's as easy as that. Walk into any health facility and you'll be attended to. Nothing is so difficult as long as you make moves to make sure that the right thing is done. My name is Ebere Inda. Thanks for being a part of the program this morning, and have a beautiful day.